Negative way. One of the most common that you'll become aware of in a healthcare facility is the demanding client. The coping behavior is caused by frustration with loss of control that the person is feeling. Strategies to help would be to learn and understand what's causing the frustration. Maybe it's an inability to communicate with the family. Maybe the phone isn't working, or something simple that you would be able to help them with. Show that you care about their situation. Maintain open communication by listening. Provide opportunities for the client to regain some control by giving them some choices. For example, in what they're going to wear, what activities they might participate in, and the choices of food. Be consistent in the manner of care. Don't avoid them. It's very easy to avoid demanding patients. They're not the most pleasant people to work with, but it's awfully important for them to know that you're going to be there and provide a consistent degree of caring. Don't take the client's demands personally and never lash out on them. Recognize that the stress and the way they're behaving is a result of the stress that they're experiencing. Discuss demanding behaviors with the nurse, and that nurse then can get the team together and develop a consistent plan for working with this individual. Addictions is another maladaptive behavior. Some people use alcohol, others smoking, and other drugs to cope with the stress that they're feeling. In your student manual, I've listed a number of statistics regarding the use of these products. The statistics may change over time, but the seriousness of the problem with stress certainly will continue. These folks with addictions need professional help. Ways that you can help would be listen with understanding, be sure that alcohol and illicit drugs are not used while in your care, and help them keep their stress levels down. In addition to a client, lots of times family members and visitors deal with stress. They might be worried and upset about the client's illness. They may feel a sense of helplessness or anger or sometimes guilt. Sometimes family members have not been very attentive to the patient prior to their entry into the health care facility. They might be feeling some guilt about their inattention to them, and now want everything possible done while they are under your care. And that can be difficult to deal with. People might be very demanding, uncooperative. They might open up some underlying family tensions that were pre-existing prior to this entry into the health care facility. Ways to help them is to listen to the family and family members, whether it's a suggestion, a complaint, or just passing the time of day. Listen to them. Many people want their say, not their way. Avoid involvement in family members. It's not advisable to take sides. If one sibling says something about another sibling, stay out of it, acknowledge what they're saying, but do not enter in or take sides in any quarrels. Answer the questions to the best of your ability. If you're unable or unsure of what to say, refer them to the nurse. And finally, understand and be patient, courteous, and professional, even when these individuals are not. I'm going to now have a panel discussion with 3 individuals that I've invited to come and join me. These are family members of patients that have recently been in the healthcare system, and they're going to share with us some of the stresses that they have experienced with use of the healthcare system, as well as things that caregivers have done or have not done to assist them. Now please watch. I've invited 3 ladies to join me today to talk about what it's like as a family member to utilize the healthcare system and some of the stresses that they experience. First of all, I'd like to ask each of you what brings you to the healthcare system, what event has happened in your life. You want to start, Julie?
Yes. My husband had a stroke at age 55, which left him totally dependent on a wheelchair. He has left side paralysis. His arm and his leg do not work, and he can't even transfer himself without assistance. So he also has high blood pressure and some other health problems, but he is totally dependent on the wheelchair and on caregivers and the family to help him.
Okay. Lori?
My experience has been I have a grandmother who has been in a nursing home for 6 years, doing very well. She entered at age 90. And my parents I have just recently placed in a nursing home for a long-term placement. They had been in for a short time previous to this, but now they're there for the duration.
And you, Kate?
My husband, Pat, at 47 years old, had his first stroke. He's had 3 of them. And in the process of that has had open heart surgery, and he's also fallen and broken his hip.
Lots of stressful events. What are the main sources of stress that you experience?
Well, I think for us, because my husband is receiving home health care in the home, the reliability of the caregiver I have to rank as #1 stress problem for us, because it does impact on the rest of the family when someone doesn't come up. For instance, one time I was to start a new job, and the caregiver called in at the last minute, and something was wrong with their car or something, and I could not start my new job, and I did lose out on that because of that. So it also creates a lot of tension in the family, and I become more irritable, and then, you know, it just upsets the whole family when you don't have someone there.
How about the others, Lori or Kate?
You know, one of the things that just comes to my mind in terms of stress, you know, each time I leave the room of my loved one, I'm always thinking whether or not there will be someone who will care for their medical care needs, who will pay attention to whether or not they're sick, and whether this person will care for their person and treat them with dignity. And that's a thought that I live with each time I leave, and it leaves me with a lump in my throat because I just don't know.
Well, in my case, a big part of my stress comes from the fact that we owned our own business when Pat came down with his first stroke, and we had to close that. I had to get a job in the outside world, away from, you know, working in your own business, and I'm the main support of our family. With all the medical bills that come in and everything, it's my responsibility to take care of this and to ensure some kind of future for us. So financial is always a big stress, especially when it's your husband, who has been the main provider, is no longer providing.
You've had to use lots of caregivers. What are some of the things that you've experienced with caregivers that has not been helpful? You think of some things?
You know, I think one of the classic things I think about is, you know, when the caregiver seems irritated or annoyed by either the disability or the personality of the family member, and you see some of the rolling of the eyes or the just glaring, and you can tell that there's a real distaste that the caregiver has, and that's always painful to watch.
I think another area that, at least that isn't helpful for us is when the caregiver, you know, we try to tell them the way that we like things done, you know, and the way that would best suit my husband's needs. And sometimes, you know, they have a set way. Maybe they worked with another patient that had a similar disability, so they think they know how to do this, when in fact each one is different. And we've been told that by other people who've come in to, like some of the physical therapists and things, that no, this is the way he needs to have it done, so you need to do it this way. And also, I think it's important to know, you know, there's like 101 ways to make chicken, but this is the way we like it done. You know, this is the way my husband likes it. And I'm not just talking about chicken, but anything that you do for him. For instance, he gets cold, he wants to have a blanket around him, and yes, it's a little extra step, but that helps him to be more comfortable, and that's what we'd like them to do.
And that's the focus.
Yeah.
Right.
That is the focus.
Right.
One of the things that I just wanted to mention was a really horrifying experience for my mom as she was admitted. Her vision's very, very poor. And so she was escorted or wheeled back to her room after dinner by a nursing assistant. And the nursing assistant did just what she was told. She took her back to her room. But what she didn't realize and didn't take the